patients want to eat. And you mentioned cake, which reminded me that Una has a very important question. Let's get that
Oh,
out of the
yes.
way
Okay.
right now.
Thank you. Thank you for giving me that opportunity. So as I told you guys, right, I've been NPO for a really, really long time. And I was sitting one day, I had a patient who was like really NPO for a very, very long time, and they just wanted to eat. And I was sitting there thinking, what about cotton candy? Like, you put it in your mouth, and it's gone. Like, and then I think I looked it up, and like 90% of cotton candy is like dissolved within your mouth. Actually went into and looked at literature, and I was thinking, right before oral care, can we give cotton candy to our NPO patients and think about making medical grade cotton candy?
I love it. Or after oral care, so we know if anything does mix in with the saliva, the microbiome's already pretty clear and safe. As an SLP, I'm like, go for it because it's a taste trial. The risk is very minimal. And like you said, it's not a big enough bolus to mix with your spit and cause increased, risk of aspiration.
Like Una was saying, in her own experience, she had asked me this question just before we sat down today, and I've been guilty, as you said, about oral hygiene, of, there's a pleasure experience from just having taste, even if it isn't a full meal, even if it's not adequate nutrition in people's rehab stay. And so I've been guilty of saying, well, what's your favorite drink? We can put that on a little swab,
Yeah.
let you
That's
get a
awesome.
taste, and then do your oral care after that. That way, anything that we did put in there that might be harmful for you is gone in the same way that your cotton candy disappears.
In the rehab world, like we would like to have some kind of safe controlled bolus, even if it's a little bit of an ice chip, to be swallowed. So we're preventing that atrophy of those muscles contracting in the swallow practice. But I think, if you don't have the opportunity to be able to safely be doing that at that point in time, then cotton candy it is.
Because you can have a sweet cotton candy, salty cotton candy. Think about the possibilities.
Well, and a lot of times we start with water. When do you do that, and when do you progress, I guess?
If they're on a stable mode of ventilation and they're not at a controlled rate where their body has to have the preset pressure or volume from the vent, and their swallow study wasn't, perfect, but we are in an agreement where we can maybe start dysphagia intervention without completely putting them on an oral diet. That might look like tiny little ice chips, and then we might use biofeedback to get their visual engagement for the swallow exercises. And in order to be engaged in that dysphagia intervention or dysphagia therapy, you do need a little bit of something to swallow. So the Fraser Free Water Protocol that was published and that's evidence-based says that risk for a pneumonia or aspiration event that will cause infection is very minimal in these patients who are taking the tiny amounts of ice with good oral hygiene. And so for our patients, that's usually every 4 hours they're getting oral care aggressively. And then we would start with the ice chips with SLP only, and kind of with the goal of strengthening the oral motor and pharyngeal swallow response to eventually get some kind of diet.